Now, while the world grapples with the coronavirus pandemic, it has become extremely important to ensure that other killer diseases such as malaria are not neglected. Malaria, the mosquito-borne disease, kills an estimated 2.7 million people every year, with 90% of these fatalities in Africa. While the two diseases may share some symptoms, there are other points of departure. Within a year of COVID-19 becoming a pandemic, vaccines are already available to fight it. How can the world achieve accelerated malaria vaccine development, drawing from the lessons in the containment of COVID-19? Well, joining me to discuss this is infectious disease specialist and executive director, Rufeka Medical and Dental Hospitals, Dr. Joe Onigbinde. Good morning, sir. Thank you for joining us on TVC Breakfast.
Thank you.
Now, let's first of all talk about the semblance or the similar presentations between COVID-19 and malaria. And that is also seemingly posing a challenge when it comes to diagnosis. Talk to us, are there points of departure that can easily help perhaps people, doctors, medical practitioners easily detect, or individuals easily detect that, okay, when you see this, you know that this is malaria or this is COVID-19?
Well, that's a very tough one because the symptoms and signs of both malaria and COVID-19 are very, very close. Very, very close. We know that, like you rightly pointed out, malaria is transmitted through yes, parasitic infection through Plasmodium and all the mosquitoes, whereas this other one is a viral infection. But it gets to certain points that, especially if malaria is deeply embedded with the symptoms are very close to that of COVID. But generally, when somebody, we know the signs of malaria, chills and all that, fatigue, and the same thing with COVID. Mainly respiratory symptoms, and then you can also have fevers. Though it's not compulsory. Some people can have COVID and they will not have fever, and some may not even have symptoms until late stages. So, but there are certain things, they are not exactly the same thing. It takes an experienced doctor or a very careful doctor to be able to separate between this and this. Right. And one of the most important things that you have to look at as a doctor is readily there are diagnosis tools for malaria parasites, but you don't have such for
COVID.
Yes, COVID. So the first thing a doctor should do is, first of all, rule out malaria through testing. But sometimes something can have co-infections of both malaria and COVID. COVID. That is where it becomes difficult. But when you begin to see malaria signs, especially the fever, tend to be cyclical. That is when
reoccurring.
Whereas you don't have that, it's consistent with COVID. So these are the things that you can use to separate. And then when you begin to treat a patient for malaria and there's no response, rather the symptoms are getting worse, then you begin to suspect you. That's some red flag that you might be dealing with something different. So it's actually very, very difficult. But if you are very careful as a practitioner, even individuals, when you observe yourself, you know this may not just be malaria, although the symptoms come very close, like I said.
Yeah. All right. Another issue is the fact that we know that malaria has been with us for years, thousands of years, but we don't see as much effort at perhaps having a vaccine or containing this malaria. We have seen recorded numbers of deaths as a result of malaria, just as we are recording with COVID-19. But the effort put into addressing COVID-19 is not what we see when it comes to malaria. One wonders why is that, or why that is?
Well, you don't need to look far before you know why it's that. You see, malaria doesn't seriously affect the advanced countries where we have all these efforts of making vaccines. It is mainly with us here, and we in this part of the world are not really doing anything seriously about malaria, how to get vaccine. But unlike COVID, where almost the whole world is a pandemic, so the people who are actually doing medical research are outside there. But we in this side that are affected by malaria, we are doing very little. Unfortunately, this is unfortunate because I happen to attend an institution where you have tropical institute in Europe. The people they are not seriously affected by malaria. In fact, rarely. Yet you see them still working. See, I had a professor who was over 70, very plump man, who was still dissecting mosquitoes, trying to find solution to it. But we don't have that here. So I think it's time the governments and private individuals actually got together to get research. We can do it. We have the resources. I'm talking of mental capacity. Our boys are very good and girls are very good. Where they go out there, where an enabling environment is created. The vaccine for COVID, the one by Pfizer. Yeah, I know Nigerian was involved.
Yes, oftentimes Nigerians are involved at the forefront of all of this vaccine creation. So one wonders why it's so difficult. Why aren't we looking at doing something from this angle? Not just Nigeria now, but African countries affected. Why are we not collaborating to get something done, knowing the numbers of deaths recorded?
Well, just as you are troubled, so am I. It's a pity that the African continent, the black race, we don't seem to help ourselves. We have to depend on the external aids and all that. Whereas we have the resources, we have the money. Don't tell anybody to see that you don't have that. We're not poor. Many of these countries. Oh yes, many of these countries are very, very resourceful. Even Brazzaville, Congo, Kinshasa, they had deposits of mineral resources and so on, with which they can harness to get all this funding. Nigerians, we have big, not millionaires, billionaires, even in terms of dollars. So why can't they come to do this thing? Why do we have to wait for the external? Nigeria is richer than most of these foreign countries that we are depending on. But because of our selfishness, because our government, they don't take help as priority in this country. And that is unfortunate. I don't know when we are going to have a change of heart. Like somebody said, when Babangida was trying to put some contraption together that we want to have a new Nigeria, then he invited Obafemi Awolowo to come and participate. Baba said, no, he was sorry, that it appears as if you are engaging on something that's going to be useless, that when you think you have gotten it, then the problem has just started. You see, unless there is an exorcism, that is, you cast out the devil in the spirit of Nigerians, that things will just, and that's what we are finding today. Things are getting from bad to worse. Nigeria was not like this in the 70s and even early 80s.
Absolutely.
No. Naira was stronger than dollar at that time. But now what do you want to? We want to have just $1. We've got just $100 in your, which is just like a small envelope. You have to carry a sack of Naira, which is unfortunate. So we have to, I think, like somebody said, we have to be born again in our spirit. The way we look at ourselves, the way we look at governance. Governance in this country is just let me rush there and carry what I want to do, what I can take, even what they cannot spend.
Right. So in looking at funding and having local research, which is where a lot of persons are even talking about for COVID-19, we need to begin to looking for local remedy, because if we are saying that we are waiting for vaccines, even the first world countries are still, pushing for more vaccines so that they can get about 50% of their population vaccinated. So if we are to look at talking about research, ensuring that we find solution to the issue of malaria and every other kind of disease. Some other persons will say Lassa fever has been here for years as well. Not much has been seen to be done with in terms of getting a cure. Where do we begin?
Where we have to begin is a change of heart and attitude, and to understand that everybody's hands are to be on deck.
Right.
Yes. we have, let's not decide, we have money, and we have people who can do the research, people who can find vaccine. And let me also say something, that it is not just vaccine to tackle malaria. You don't have malaria in US or any other. One of the problems we have with malaria is our environment. Our environmental health has to be addressed. You know, there was a research in the 19th century when they had malaria in Europe, in Great Britain to be precise, and they discovered a certain community was the one, people were coming down with malaria, and they did research and they found that these people in that area, this environment was was a problem, and they took off the environment, and that was it. But so you have to also talk about, let's not just think of vaccine first. Let's think of our environment. You see, you have ponds, you have people rearing animals. This is poverty also. There's people rearing animals in residential areas and then dig pots and so on. You have, malaria parasite now. You are breeding malaria parasite. So we have to look at that also. Then later we will now have vaccines. When you have tropical institute, people who can do research.
All right. There is a vaccine that has been done, and it is said that it wouldn't be readily available until 2024 or so. And they're also looking at perhaps herd immunity, like we are looking at for COVID-19. How do you see that working out in terms of addressing this issue of malaria, first of all?
How do we...
Herd immunity.
Oh, herd immunity.
Yes, where certain number of persons are vaccinated
yes,
to address, perhaps flatten the curve, if I may use the word, especially for COVID-19. And that is also being considered for the vaccine for malaria. How do you see this working out, or how does it even work?
Well, I'm not too optimistic about that, because number one, we don't have any potent vaccine for malaria now. So before you can achieve herd immunity, like rightly pointed out, you have to get a certain percentage of the community, about 75% vaccinated. So I am not too optimistic about that. So I think we should first of all address the area of prevention, which is by taking care of our environment. Let's not just wait for a vaccine. Why don't you say 2024 before you can have that playing out? So I think we should address the area of taking care of our environment, and when you can have less attack of malaria. So I am not too optimistic that herd immunity against malaria will work out in Africa.
Right.
Yes, I don't think so.
Okay, because of our environment?
Our environment and our attitude too.
Our attitude in what sense?
Our attitude that we don't... What the people who are going to do research? Is it people who have not put their... who are struggling to make ends meet? Are they going to do research? Are they going to use their private money to do research? So I don't see that playing out, because our governments and our very rich people are not really committed to finding out, do any research in medical research. So I don't think that is going to... Let's not deceive ourselves. Like you are told that we're going to have vaccination against COVID-19 by January. You brought me here that I was laughing. I said, if we have it by April, let us...
But now we heard that we're going to have something by the end of this month, that's February, because we are told that the BUA procured about 1 million doses and from AstraZeneca, and we should be receiving that possibly by the end of this month.
Have you seen it? These are political statements, number one. And then
really?
And then even if they are here, you see, I am sorry, I'm not negative. Okay. But our attitude is, some people will still hold it, just like they hold what you call palliatives. And they say it's supposed to be free. They will be selling it. So we just pray to God that we should have a change of heart. If you get it by April, I will be happy. Yet we need it. Yet we need it. But our attitude has to change. Our government, they have to know that they have a commitment, a social responsibility to the populace. So that is the problem. If we have it by April, great. For February, let's call me again later to let us see.
But then again, let me pose this question that I've been asking, because this stream AstraZeneca, as much as we are hoping and looking forward that at the end of February we'll get this vaccine, we see what is happening in South Africa in terms of they also purchased this vaccine, and they carried out tests up, vaccinated about 2,000 persons, but they are disappointed by the results they are getting, that it's not having as much effect against the COVID-19, perhaps because of the strain. And the question we have been asking is, should Nigeria still go ahead with the purchase of this vaccine, AstraZeneca, seeing what's the results we're getting from South Africa?
I think, this is a personal opinion, I think Nigeria should still hold on to, as far as AstraZeneca's, the one by Pfizer and Moderna, they are much better. At least we have better results. So I will. But
the cost is seemingly a challenge.
Yes, they are more expensive. So you should not, because of cost, go and get something that you're not sure is going to work. So I will not encourage us to take that version of vaccine. There are people in this country, I keep saying it, there are people in this country that can bankroll vaccines from Pfizer. Yes, there are people. How much does it's going to cost? Maybe say 400 billion, whatever. There are individuals who have more than that.
That's a huge
cost. That is huge to you and myself, but to some people it's nothing. Some people it's nothing. So if it's just that the interest of the people is not in their heart, if they have the interest of the people, a few people can come together and get this thing for us at no cost.
So involving the private sector is what
PPP.
Collaboration.
Yes, PPP, that's what I'm suggesting. Public private partnership. Yes, this is what I'm suggesting. If you want to put everything on the government, on lading everything on the government, that might be difficult. Actually, all over the world, health facility, health care does not depend solely on the government. There are other partners. So if you have some other people who...
But is the government pushing for that from the body language they are seeing?
From all indications, no.
Right.
From all indications, no. Well, I don't have access to some information, but from all indications, no. They are all still struggling on how to take what they want to take before they are pushed out of office. So if there is a collaboration between the public and the private, I think they can get us good vaccine.
But for administering the vaccines, government is saying that no private organization or body would be given that go ahead to administer vaccines. And there's also the question of, can the government alone handle it without the participation of the private sector?
That is laughable, because our institutions, our government institutions are not functional as it were. We have I'm not saying they are not functional, we don't have enough. They are not, the capacity is low. Inadequate compared to the population. So I don't see how they are going to do it alone without giving to private individuals, people like me. We are the people who actually, we interact with the masses. And a lot of people are even running away from government practices now, because when you go there, they will test you for COVID, you will come back. So they are running away from government sector. I don't see how government can effectively handle this on their own without giving it to private practitioners.
Another issue is the fact that we have 13 infections of the new strain found in Nigeria. And the question on the lips of many is how they are able to slip in despite the measures put in place by government for inbound passengers, how this strain was able to still make it into Nigeria.
Well, it's baffling, really. But I don't think it's difficult knowing who Nigerians are. A lot of people get through our borders without, you just bribe their ways, even when they don't have negative
result.
Yes. So where it is difficult, because before you can even board plane, but there you have to should test
Yes.
positive. I know that this strain has actually been with us as early as August last year. So, and we didn't have very strict measure protocols as
In
at that
place.
time. Yes. So we are just seeing it. Well, good enough. It is not as it's not too vicious. It's not too aggressive. It's more in terms of transmission. It's faster. More, but I don't think it's more dangerous than in terms of mortality than what we had before. But I think that this thing must have crept in surreptitiously at the time where we are letting down our guards.
Right. And so what do you think the government should do now, moving forward, in terms of, since our airspace is still open, what more should the government be doing?
I think the government should still we have to clamp down on incoming passengers and be stricter with all the protocols at the borders, because for now it's dangerous. We have both from South Africa and Europe. I don't think we need to allow people to come from UK for now. There are over 42 countries actually banned flights from UK. So I don't know what the government is still doing, at least for some time, even if it's for a month or two. Let's place a ban for flights from UK in particular.
All right. Well, infectious disease specialist and executive director of Feka Medical and Dental Hospitals, Dr. Joe Nigbide, thank you for speaking with us.
You're welcome. Thank you.